I'll stand behind you.
Oh, you're
And I'll stand behind you.
All right. All right.
Now you're gonna get everybody.
All right. Smile, everybody.
At which camera?
Yeah, who's taking the picture?
All right, look at Suzanne. She's doing it.
KidsWell has had a tremendous impact on the way we work on children's health policy here in Maryland. It's helped us be more focused and purposeful about our work together. And if you think about it, over 300,000 Marylanders got health insurance coverage, and that's tremendous. And that's what KidsWell means to me.
It also allowed Advocates for Children and Youth to expand our staff. We now have a senior health policy associate and an outreach associate, and that has made a tremendous difference in reaching out into the community. But it was one of the first grants ACY has ever had that allowed us to really stand back and figure out where we could be, where the value added was for Advocates for Children and Youth. We weren't required to pick off one little segment or do a small report on one portion or one piece of legislation, but we could be part of the overall implementation picture. Co-chair two separate Navigator advisory committees, which in fact set up the model for the Navigator program, including the 6 regional Navigator Navigator entities, which came to be known as the connector entities. And these connector entities then establish relationships with partners in the community, and that gets back to Suzanne's earlier point that these partnerships with folks who are on the ground and familiar with and trusted members of underserved communities really helped with our really stupendous Medicaid enrollment over the last few months. So thank you, KidsWell.
Because of the KidsWell program, we were able to be really involved in the implementation of the Affordable Care Act here in Maryland through work groups, stakeholder advisory committees, and things like that, and which ultimately led to a connector entity program for navigators and assisters here in Maryland that served everyone well.
So throughout the grant period, we had the opportunity of developing a lot of materials to help us with our outreach efforts and around the enrollment process for the ACA. One of them was this Prezi presentation. It talks a little bit about different scenarios for families, individuals, former foster youth, for their healthcare coverage options. And it was a good opportunity for us to talk about the different types of situations individuals in Maryland are going through.
Other organizations really were able to develop, first of all, a connection to the New America Media. We did 2 media events, actually media roundtables with them, which I think were very productive. We had good participation by ethnic media around the state. Connection that it really solidified was with Georgetown Center for Children and Families. And although we had both independently worked with them for a number of years, having them as a research arm and as a real resource as issues came up in Maryland was tremendously helpful.
I'm a communications department of 1, but KidsWell allowed me to go to the Spin Academy, in which they taught nonprofit communication leaders how to be more innovative in the way they go about expressing their company's cause and our mission. It allowed us to look at things not as what is impossible, but what is possible to do with a little.
I would say the biggest challenge we faced here in Maryland over the past 3 years of implementing the Affordable Care Act has been uncertainty. Because of our advanced implementation timeline, sometimes we got ahead of federal regulations when we were designing how our exchange was going to work, or different designs of different other internal programs that had to be reevaluated once we got the federal guidelines. But because KidsWell allowed us to have such strong partnerships with each other and with state officials, we were able to, really roll with those punches, so to speak, and modify our approach, refocus, and stay on track to achieve, stay on the timeline that we had set forth, and really maintain our status as a state that was in the lead to implement the Affordable Care Act and expand healthcare coverage for so many Marylanders. The sustained funding from KidsWell had a tremendous impact in these critical years that allowed us to stay focused on really our mission rather than worrying about whether or not we'd have the capacity to capitalize and really make the most of these, once in a lifetime opportunities for kids.
I'm most proud of the fact that we're able to work together and to get things done, those things that are important to and for the people in the state of Maryland. We've been able to open doors in Annapolis that no other organization of this kind has been able to do, and getting things passed through legislation.
So the legacy of KidsWell in Maryland is that we now have many fewer uninsured children, and that we are well on our way to making sure that every child in Maryland has access to quality, affordable health insurance. Even little Christopher.